Next, let's go to Cheyenne Haslett at ABC.
Thanks, guys. For Dr. Fauci, I had a question for you. If you could talk a little bit about this next age group waiting for vaccines, kids 4 and younger, any updates on when we will hear from Pfizer on data? I think you talked about that coming in the next month or so. And if you could clarify if this will be for a 2-dose or a 3-dose vaccine, which is expected to be sufficient. And then on Paxlovid, do you think the rollout to patients is going well, or are there things the government could be doing to make it easier to obtain?
Well, I'll answer the first question and then turf to Jeff to answer the second question. With regard to the clinical trials that are being done in children from 6 months to 24 months and from 24 months through 4 years, as you probably know, the original data that was done was determine if the doses that were given to those children reached what we call non-inferiority with a more adult or adolescent population. And the original data that was put forth, it looked like the dose and the regimen for the children who were 6 months to 24 months worked well, but it turned out that the other dose, namely the other group from 24 months to 4 years, did not yet reach the level of non-inferiority. So the studies are continued. It looks like it will be a 3-dose regimen. I don't think we can predict when we will see an EUA with that because the company is still putting the data before the FDA, and I certainly don't want to get ahead of the FDA because I'm not privy to the data, and even if I were, I wouldn't want to anticipate what the FDA would do. I think we just need to be patient and know one thing for sure, that that's why the system works, because the FDA is very scrupulous in their ability and in their effort to make sure that before something gets approved for people at any age, including and especially children, because of the special vulnerability of the children, that when these vaccines become available for children at those age,